We have a public health emergency in London and across major cities across the country. Thousands of premature deaths each year in London because of the toxic air. Across the country, it's 40,000 premature deaths. We have children with stunted, underdeveloped lungs caused by the poor quality air. Every day there are 4 Londoners hospitalised because of the bad quality air. One of them, on average, tends to be a child. But also we've got adults with a whole host of health issues, from asthma to dementia to cancer to heart disease. And what this policy that starts today is a package of measures to try and improve the quality of air in London. We've got to make sure that we haven't got a situation where the air in London is getting worse rather than better. We've seen, I'm afraid, in the past, politicians failing to take action. Nationally, the politicians failing to take action. Here in London, from City Hall, we're taking action. We don't want a situation where children or others going to hospitals are in areas where the air is illegal. We know that there are more than 450 schools in areas where the air is illegal. There are more than 500 NHS institutions in areas where the air is illegal. As a consequence of our policies, the air will become illegal, and that will lead to children and others living in areas where the air is not affecting their health. We can't have a situation where, in the greatest city in the world, we've got this invisible hidden killer that's making our children unwell.
One of the things with this policy is the potential benefits for children with asthma, who are very much often at the mercy of the environment, and it's hard for them always to take proactive action within that wider context. I think also that some of the children I look after who have disabilities or who have other conditions that require that they are transported about, those vehicles that transport them have had time and continue to have a little bit of time to make the necessary adjustments. So this is a policy that's been thought about from the perspective of children and young people. And I think asthma is a condition that we don't talk enough about. It's not always one that gets the headlines, and so things that help shine a light on a long-term condition like asthma are useful in many ways.